Hi, good afternoon.
Can everyone hear me?
Hi.
Yes,
Hi, everyone.
Hello.
Hi, my name is Charles.
Hi, is this the full
Hi,
team?
Charles.
Hi. So we are all the panelists, are we?
I'm not 100% sure. Who is that? Is there anybody else we're waiting for? Okay, I propose we go ahead and start.
I don't know if you can hear me. Great. Yeah, I think it's just us. Mwenya, you're the one moderating. Welcome, Ife. I hope I've pronounced that correctly. And welcome to Tetteh. We are expecting one more person, Sodiq Oloko. Just trying to raise him now, and then I should get back to you in a minute.
Okay.
All right.
Sorry, is it so obvious that I'm taking my call from the car?
Abundantly obvious that you're a very nice car, it seems. I don't know if you're in the same economic situation as the rest of us.
Hi, everybody. I'm Tetteh, one of the organizers. Welcome. I've just posted the link to the main group, so we're expecting people to start joining.
Okay. We haven't heard back from Sodiq yet. I'm hoping that he'll join us in a few minutes. But in the interest of time, I think we can get started. We have the attention of quite a number of people, and we're trying to be respectful of their weekends. So yeah, I'll leave it to you, Mwenya.
Thank you so much. And thank you to everybody for joining us. You're all very welcome. A warm welcome to my panelists. I'll start by introducing myself. My name is Dr. Mwenya Kasonde. I am an emergency medicine physician and a global health consultant. I previously served as Assistant Director for Global Health at the Ministry of Health in Zambia, and I currently consult as an independent for private sector entities, governments, and UN and other development agencies. I also co-chair the Gender Equity Hub at Women in Global Health. The discussion we're going to have today is going to be centered around medicine and healthcare, especially in the context of this conference, which is this African Renaissance that we'll be talking about. So what I'm going to do, I'm going to start by allowing my panelists to introduce themselves individually, and then I'm going to ask them one question, and the question is, what role does medicine play in enabling societies to flourish? So Ifeoluwa, I will let you start by introducing yourself. Over to you.
Sure. Hi, everyone. My name is Ifeoluwa Olokode, and I'm the head of partnerships at Helium Health. And what Helium Health does, we are a health tech company that's building the digital infrastructure to power healthcare across the continent and across other emerging markets. So that's what we do. We started out with our core products, which is our electronic medical records, hospital management information systems product. And now we are layering on other solutions to other problems in the health sector. So happy to be here.
Thank you so much. You're very welcome. Charles, do you want to introduce yourself?
Thank you very much, Mwenya, for moderating this. My name is Charles Kamau. I'm the head of partnerships for mHealth Kenya. mHealth Kenya is a public-private partnership outfit, and we work closely with government directly, both nationally and subnationally in Kenya, to try and strengthen the health system, primarily from a point of primary healthcare. And so we ask ourselves the fundamental question of the fact that you own a mobile phone, how can we improve your health? And so, so that's what mHealth does, and I'm happy to be here. Thank you.
Fantastic. Friday, I'll let you introduce yourself.
My name is Friday Nyambe from Zambia. I'm the indie developer from Grace Investment Limited. I make games such as virtual reality and small websites. Thank you.
Great. So you're very welcome. Sodiq, please introduce yourself.
My name is Sodiq. I'm head of operations and bank, and I live in Lagos.
Okay, you're very welcome. There's a bit of a delay.
Thank you.
Great. Tetteh, I'll let you introduce yourself. I think you're muted. We can't hear you. Unfortunately, we still can't hear you, Tetteh. We're not getting you. Okay, I think maybe if our organizers can help Tetteh in the background or somehow, maybe we can come back to you hopefully in the next few minutes, then we can have that issue sorted out. So again, the discussion today is about modern medicine. So I'm going to take it all the way back around the table. I'm going to start with you, Ife, and I'm going to ask you to speak a little bit on your perspectives on what you feel the role that medicine plays in enabling societies to flourish. Over to you, Ife.
So medicine, I mean, I think we can all agree that, without health, without healthy people, we won't have a productive society. And medicine ensures that we have healthy people, or, makes being healthy a possibility. Modern medicine, without interventions, we will have, diseases that are ordinarily, curable, run rampant. So without medicine, really, we won't have a productive society. We won't have a creative society. We won't have, it's basically the foundation of everything else. Yeah.
Absolutely. I agree with you. I couldn't agree with you more. Just a bit of housekeeping. We have 1 hour for this session, and I've lost some of my speakers, it seems. We are 3 or 4 if you count myself. So I'll give each speaker 5 or so minutes to give their interventions. I have about 2 or 3 questions to ask them. And then I'd like to open up to the floor for the remaining few minutes in case of any questions. And I like what you just said, Ife, about modern medicine being so fundamental to any type of development, any type of renaissance, as we are calling it. And I'm going to just throw a little bit of spanner in the works for a second, and I'm going to argue that healthcare and medicine are possibly the single most important investment that we all must make in order to flourish as a society. And I'm going to tell you why. The health sector is a key economic sector. It is a job generator, and it is a driver of inclusive economic growth. Demand for health services has increased exponentially during this pandemic and will continue to increase. And the WHO also predicts a shortfall of 18 million health workers in order to meet the 2030 SDGs. So investing in health, we're not only investing in healthcare itself, we're involved investing in the healthcare workforce, we're investing in economic growth. So Charles, why don't you give us some of your views on why you think modern medicine plays a key role in enabling societies to flourish? Over to you, Charles.
Yeah, I mean, thank you very much. I think for me, I really struggle with the fact that we keep on saying modern medicine, and my struggle is because the duality, the nature, the duality of the fact that it's life and death. There's nothing more modern about dying and being alive. So when we throw in the thing about flourishing, again, what we are saying is that the fact that single-handedly, every person who works within the healthcare space or any other intervention that is done within the healthcare space then throws you into that balance of being at the front line of whether someone lives or someone dies, and that's my that's my outlook there. I'm a trained nurse in Kenya, and I did practice nursing before I went into digital health, and nothing is more real. So when I was working in the front lines, it was more of, yes, you're caring about someone so they don't get sick or they don't get deteriorate. And even now that I'm working in the digital health space and looking at the primary healthcare space, it's more of just doing that, the flourishing. And like you said, a healthy nation is an empowered nation. A healthy community is an empowered community. And you see the fact that I normally really want people around me to understand that medicine and healthcare is not just about the taking of a substance. It starts from how you take care of yourself for you to actually not end up in a hospital. And so it's a journey, it's a spectrum. And most people really look at it from the point of medicine in terms of, I'll take a drug, then I'll be okay. But if you look at the journey of some of these cancers, it is how we live our lives. If you look at some of the journeys of some of these non-communicable diseases that are now on the rise, it's how you live your life. If you look at, and I was arguing there with someone else the other day and telling them, during this corona period, even post-corona period, what you're going to be dealing with is a lot of psychological issues. Just the distortion of that alone. Are we creating systems that are able to sort of handle this flourishing that you're talking about? I'm a very good example. A friend of mine from Zimbabwe, and many will argue this is not medicine, but it is actually what leads us to health. It's what leads us to be a healthy society. So I reckon that in Zimbabwe, they normally have, up until last year, they have about 12 psychiatrists in the entire country. But one of the things that they realize is the fact that the grandmothers in these areas in Zimbabwe are very trusted as people who can talk. And so sometimes, and because they are idle, per se, because they're retired, and so this person created what they are calling the friendship bench. Professor Dixon Chibanda now. So and he created employment for the grandmothers, and also gave an opportunity for people, for people to go and sit with his mother just to talk about what you're going through. So I'm seeing more friendship benches coming in post-COVID, and that is modernity. Can you imagine just sitting somewhere on a chair, just talking to someone about what you're going through? And I think so. I really want people to sort of think about modernity in terms of medicine in Africa, not just something that is going to come and meet us, but something reinventing what we have to suit our current times.
Thank you so much.
Thank
Charles. I definitely agree with your perspective on being holistic and addressing healthcare across the continuum of care. Healthcare starts at the home. It starts with the promotive, preventative services, as well as being curative and palliative, etc. So I think that's an important point that you make. We've talked a little bit about your involvement in digital health, and I know, Ife, you have somewhat of an involvement in that sector. I see you smiling. So I'm going to bring up that discussion again a little bit later on, because that's, I think, an important thing to touch on when we talk about this so-called modern medicine that we may or may not agree with, the term that we may not agree with. So Sodiq, why don't you give us some of your perspectives on the role of medicine in enabling societies to flourish? Over to Sodiq.
Thank you so much, everybody. First, I'm sure you'll agree with me that healthcare is considered one of the most important factors when you're to determine the state of governance of any government, and it is really, really important that. And this is not far-fetched. I think the only reason is because the important factor to determine the physical and mental well-being of the people of every society is, and definitely it contributes to the country's economy, and that healthcare or medicine is actually one of the most critical things that every government should take seriously, or that, because it's also like a yardstick everyone uses to judge government and say, okay, this person has done well, look at what he has done in healthcare, look at what this person has done in this and all of that. But healthcare is always like up there, and everyone just wants to talk about it. But we know that just according to WHO, we have about of the 6 building blocks of a working healthcare system. I think one of the major ones that we are lacking in Africa is the access to essential medical service, which one of the things Life Bank is actually solving, and I feel this is really, really critical. When you have the hospitals, you have the personnel, you have everything, you have everything you need to operate, or you have anything to deliver service, but there is no access. You do not have access to essential medical products like blood, or oxygen, or insulin. This is like this has been like a major problem in Africa, and I'm now sure, of course, with the help of technology, like even companies like Life Bank and other startups are actually working really, really hard to solve this problem, and I'm sure in no time Africa will be up there and be compared to everyone across the world.
Fantastic. Thank you so much, Sodiq. Tetteh, I wonder if you're still with us. Do you want to go ahead and introduce yourself and give a bit of your perspective?
Hi, yes, I'm with you. Can you hear me now?
Yes, we can.
Okay, great. Introduction. My name is Tetteh. I'm a African American currently based in the U.S. Both my parents are Ghanaian, so Ghana, despite having unfortunately not lived there myself as of yet. And my background includes the mental health world as well as intersectionalities with criminal justice. Last several years, both teaching as an adjunct lecturer in criminal justice and treating, assessing, and consulting offenders with mental health difficulties in the criminal justice system. So to relate that to the initial question as to how medicine can help us flourish, particularly in Africa, I think within the umbrella of medicine, then what is left out is the aspects of mental health, which, as we know, have significant correlates to everything from recovery of particular diseases, their onset, from hypertension to stresses to anxieties and blood pressure. So I think for today, the role it serves as far as helping us flourish is an awareness of normalizations of the conversations around the difficulties we experience. So for me, I'd both like to spend from a lot of you all as to how I, as part of the diaspora, can bring others in to make those contributions with the skills that we've developed. Our brilliant co-founder, Mwenya, mentioned earlier, there is a lot going on for the diaspora globally. A lot of things that can be paralleled, but unfortunately, we're existing in silos. But one thing that is a commonality is that lack of normalization of conversation, which I see more people than anyone. So I think that moving forward, furthering that conversation around mental health, furthering expressing our experiences, the pain that we're in, the thoughts that we have, no matter how negative, can help us, as we say, self-actualize to lead overall better lives.
Thank you so much, Tetteh. Some very important points indeed. We cannot underestimate the importance and the value of mental health. And it's something that we as a society are all guilty of. We all are doing underestimate the importance. We all underinvest in mental health services. And during this time especially, is something that's particularly important. So I appreciate your comment on that. To pick up a little bit on what you said, you mentioned the role of the diaspora. And again, that's so important. I'm a diasporan myself. I'm a Zambian, but I'm currently living in the UK. And for me, my perspective on that is partnerships. I think partnerships are really, really important, especially in these times. I don't think we're going to get anywhere without clear healthcare partnerships. And one of the most important things that we need to do as healthcare partners is share information. I'm going back to my data digital health conversation because that's something that is really on my mind these days. So in order to be true partners, we need to be able to be transparent in the way that we share and manage healthcare data and healthcare information. The next question is around challenges. And I don't want to talk too much about the problems that we have. Mwenya said in his introduction, this is not a discussion about African problems. We've had those conversations and we're over it. We're trying to have conversations about solutions and about ways in which we can revive our economies, our societies, our artistic talents, etc., in different ways. But we still need to talk about the issue of challenges in this particular context. And for me, I'm going to argue that our biggest challenge right now is COVID-19. I'm going to take it ahead of me because I know we're all tired of talking about COVID-19, but I say this for the following reasons. Not just because of the pandemic itself, but because of its effects on essential health services and the way it affected our economies. Africa, I'm going to argue, was not less prepared than the rest of the world. People have said Africa is not prepared. Actually, Africa fought HIV, Africa fought Ebola, Africa fought cholera. We've been fighting pandemics since as long as you all can remember. So my argument is not that COVID-19 is particularly a problem in Africa. And I realize that, yes, our health systems are fragile and maybe a little bit less able to cope in some ways. But I also think we need to level the playing field in somewhat and discuss this in a way that is coherent to our own individual perspectives. So Ife, the mic is yours. Tell us about some of the challenges you feel that we are still facing, and please come up with some solutions as well. Ife, the floor is yours.
Sure thing. So I think, some of the major challenges that we're solving at Helium Health, like market fragmentation is a big one. Market fragmentation, the lack of reliable data really in the space, because honestly, other sectors, the financial sector has skyrocketed in its adoption of technology, and there's more financial inclusion. People are using data for really interesting things, but I feel like healthcare in Africa is still archaic. A lot of health records are still paper-based, and when things are trapped in paper, it's harder. It's more difficult for you to extract knowledge and extract data and make data-driven decisions. So I would say market fragmentation, the lack of data is really a core problem in African healthcare. So, for example, now, like if you were, receiving care at one hospital, right, and you maybe move to a different part of town and you go to a different hospital, like that there's that break in care. There's no continuity of care. So it goes from like the minuscule, doctors don't really have your complete patient history, to this public health authority is learning about clusters of disease late because people are still reporting, maybe they're reporting information like a month later or 2 months later. So there's this like lag in our response to the changing healthcare landscape because we don't have that information and because that data doesn't move freely. And that's what we are solving at Helium Health is the data problem, the fragmentation problem. We always emphasize you can't make decisions if you don't have data, right? We're just estimating and guesstimating and using our gut, and that's not particularly effective way to change healthcare on the continent. So so those are the problems, but we are solving them, right? There are indigenous companies that are doing amazing things in healthcare on the continent. And at Helium Health, we created a suite of solutions that are, easy to use, that are easy to deploy, that take into consideration the unique circumstances of healthcare in Nigeria, in Africa. And we've seen, tremendous growth and adoption of these solutions. And our overall aim is to connect all the pieces digitally and make healthcare, access easy for and affordable for everyone. Use technology and data to make things more efficient. So that's what we're about.
Thank you so much, Ife. And again, some very important points have been raised. We cannot underestimate the value of data-driven decisions and evidence-based policy. It's so important. You can't just wake up and start guessing. It all needs to be data-driven. Somebody, and forgive me, I don't know who it was, but somebody also once said, if you cannot measure it, you cannot improve it. Mm-hmm. Again, it just speaks to the importance of data. You also, to me, have touched on another important topic, which is the healthcare ecosystem. Healthcare is not just hospitals, 30 years in just hospitals. It's not just doctors. We talked about medicine. There's so many things surrounding healthcare. And that's why I continue to argue that healthcare is one of our most important economic investments. Healthcare will fuel economic growth in so many ways. The healthcare sector delivers direct and indirect economic value through its multiplier effects. In 2014, for example, total pharmaceutical revenues worldwide exceeded $1 trillion US for the first time. And according to Forbes magazine, pharmaceuticals and biotechnology are two of the world's most profitable industries, ahead of IT and banking services. So we cannot underestimate the importance of healthcare, especially as we aim to develop our economies. Charles, give us some of your perspectives. Before you do that, we have a new panelist. It seems Sally has just joined us. Sally, will I let you introduce yourself? No, maybe not. Okay, so Charles, give us some of your challenges and please give us some solutions as well. The floor is yours, Charles.
As Ife was talking, I was just really nodding and agreeing with her and also the sentiments that you said. But I would like to say two things. The problem of Africa, in my case, is really about access to healthcare, because and the fact that we've introduced the thing of the discussion about data-driven and evidence-based decision making. It really changes a lot. Let me give a very quick example. So for example, when a county, which is at subnational level within Kenya, talks about having 20 hospitals in their area, what data has, use of data, what normally tells us is that the fact that where is that hospital? Where is it geographically? The fact that I live here and next to me there is a hospital, does it matter? Because in between there's a very big river and I can't cross the river to get to the hospital. So that means if I want to have access to that care, I have to go 30 miles to the hospital, yet the government has said that there is a hospital 1 mile from where I am. So it's really layering all these things on together for us to get to a solution. Having said that, I'm very passionate about engaging communities with their own health, because I believe in the fact that if I own my health, then I will help the government help me make the decision about my health. And most of the time, really, this is some of the reflections I normally have when I think about the times when I was practicing as a nurse. When someone comes to you and they're sick, you are their last solution. So whatever you tell them, it's a do or die, if you ask me. But what if we start engaging with you about your health way before you become sick? You become empowered, you actually come to the hospital 50% well already, because you've started actually thinking about you getting better. Having said that, and also looking at the COVID-19 times and everything, like you said, I also feel like we were not less prepared for COVID. We have a phrase in Kenya, and our cabinet secretary, His Excellency Mutahi Kagwe, says, if you treat this disease normally, it will treat you abnormally. And it's a phrase because and I think that came out when we really started embracing social and behavioral changes, because the fight for corona anywhere in the world is not we have known purely. It's the fact that we don't have, we still have trials going on and on. The fact that we don't have something that you can substantively say, we'll give you this, then you have it. The fight for corona has purely been based on social and behavioral changes. And that means discussion. And that means telling people that this is your health. And that means any modernity. I think someone was making a joke and saying, can you imagine a whole disease has brought us the basics of just wash your hands? Things that we were taught when we were like really young. And so even with my embrace of modernity in medicine, my embrace of modernity in health is let us reinvent what we have. Our solutions are within us. And I think, Dr. Mwenya, you're pushing for me to really give a concrete solution is let us start engaging people with their health from a very, very, tender age. Right now, when I go visit a place, I'm very cautious about going to a place without my sanitizer. I'm very cautious about going to a place without my mask. I'm very cautious if someone really comes close to me. the fact that this is coming, for me, having lived a point where you would hug each other and do everything, and so if we start teaching the children, if we start teaching our young generation to own their health, then the solutions will be right within them. And as I finish, because we will get into another phase where we will now start talking about vaccination. We'll start talking about clinical trials for COVID-19. Acceptance by the community to try or to be part of these trials will be the key success. You can't say, and I want to quote a friend of mine, Dr. Givenji Gitahi, who said, the problem with medicine and the problem with science is that we normally start with the science, then come to the community. We should always start with the community, then continue with the science, because we feel very sharp outside here making solutions for everyone. Then you get to the community, and something as simple as accepting that you'll get a medication or you'll get a vaccine becomes a challenge. And this is a reality. And these are the community norms. I think for me it would be more increasing community engagement for owning of health, and then the solutions can emerge from within us.
Thank you so much, Charles. Again, some very important points have been raised. You've just emphasized the cross-cutting nature of healthcare, and that's just so important. We often talk about having a whole of government approach and fighting COVID. And forgive me, I don't want this conversation to be about COVID, but you've now twisted it so much to talk about a whole of society approach. Really, everybody has to be a part of it. The communities, in Africa, we have our traditional leaders. They need to be involved as well. We respect our religious leaders. They need to be involved as well in all these decisions. And of course, the communities themselves, very, very important. So thank you for bringing that up. Tetteh, some problems and some solutions, challenges. Problems is a strong word. Challenges and solutions.
Very much, and I told off of what Charles mentioned in that I do believe that although we can look at challenges from a macro, in my case, the way I look at mental health and medicine in Africa, it is, okay, how can we improve our policies and our procedures to encompass access and further awareness to those difficulties? But when it comes to mental health difficulties and them, we usually think of those which are overt, i.e. the individual who may have schizophrenia and you see them on the street talking to themselves. In our culture, they're often isolated, so that is one layer. The other, however, which I want to build off of what Charles said here, is the more covert difficulties, in that every day we are dealing with stressors. To tie this in, it's probably the single most significant global event of isolation that we have all experienced. What does that mean for attachments to their caregivers? What does that mean for their development and ways to interact with other people, build relationships, all of the things we know in order to develop in a healthy manner? So I feel like in addressing those challenges, it really comes from a people perspective, in that us are the ones who should motivate the change in policy. And by that, I mean practicing skills that we can easily relate and teach to one another, understanding when and being transparent about when we're experiencing difficulties, and not just what we might be used to describing, oh, I'm blessed or I'm tired. That is a very limited range of descriptions from the breadth of emotions that we all feel. Hope, despair, hope, contempt, fragility, anger. However, we can't label them. We're not able to develop further insight as to how to treat them and how each can develop a person-centered means of improving over time. So I think that within our nucleuses, within conversations like this, and I'm starting to see it particularly with the youth, which is why I'm equally hopeful, as Mwenya earlier mentioned, in that we are checking up and need to continue in a way which allows the people to express themselves, but also for us to be receptive to them and not necessarily be quick to feel as though we need to provide someone, you're having a hard time, it'll be fine in a week. Don't worry about it. All things in God, which are absolutely amazing, but they need to be pragmatic, emotional intelligence.
Thank you. Thank you so much for that. Sodiq, you spoke a little bit earlier about challenges surrounding access to medicines and medicinal products. Have you any solutions to those challenges, or have you anything else that you want to raise within this discussion? Sodiq, the floor is yours.
Yeah. Like I mentioned earlier, one of the major problems, or like for me, I still believe is the major problem we have, because as we all know, we have like 3 levels of healthcare. We have the primary healthcare, secondary, and tertiary healthcare. If at the primary healthcare, I cannot get basic, Panadol, basic things that I need for headache or even flu or something like that. This is a major issue for us as a continent, because I'm not sure. I think there is a gap in our healthcare system that does not allow the primary and the primary healthcare function as they should. Because if they have all of these essential products, essential medicines that they should be able to attend to, patients whenever they come, in a region, or let me say in a community where they have a primary healthcare center. If the people in that community cannot access that, the healthcare center and be rest assured that, okay, I have flu, I have headache, I should be able to go here and I'll feel well. I feel it's a problem, because most times now people will have to go to the secondary healthcare centers or even the tertiary healthcare center, basic healthcare, which is really something that's bothering. And I feel for us at Lightbank, let me give Lightbank as an example. Before Lightbank, when hospitals need blood, in Lagos, for instance, when hospitals need blood, it takes them about 24 hours before they could access this blood. And most times, because of the traffic block and all of that, they send out ambulances and they try to get this blood, and it takes them before they can get it. But since Lightbank arrived, we actually deployed smart technology and also smart logistics to help hospitals have insight into where these products are and how. So there are 2 things. First is getting to where the products are, and then that was the first solution we provided. And we thought about it again. Okay, now these people know where these products are, but they cannot have access to it. So we know these products are about 20 kilometers or 30 kilometers away from you, but there is no means of getting this product. So we launched our logistics platform that actually deploying the smart logistics to help hospitals deliver these essential products. So we do not just this is another problem again. Delivering this product is a problem. Now delivering it in the right condition is another problem, because a lot of times hospitals just send the nurses and stuff one of the hospital personnel to just go get it without, a proper cold chain, equipment. But we've arrived, we've been able to solve that problem. And this is one major achievement. And it is something across Africa, if we were able to, I think for me, just like what Charles, for me, COVID-19 would actually make Africans look inward, because a lot of things that we believe, a lot of times our even health government officials travel out of the country to go receive treatment and all of that. It was so funny that people even outside the country, when the corona really hit the world, and everyone outside the country started running back to Nigeria, started running back to Africa, because the cases in Africa were so mild and all of that. So with the current coronavirus, I feel like what's from now on and be able to solve our problems.
Thank you so much, Sodiq. I like what you said about not just the access to medicines, the medicines themselves, but the entire supply chain. So you went into the cold chain and all of these issues that are indeed very important. The discussion about innovation is also something that I'm going to move on to next, because that's another important point that you raised. We're talking now about smart technology. We're talking about drones in some parts of the continent, especially in Rwanda. I believe they've been very successful in deploying drones to deliver medicinal products. And of course, the topic of the day, which I'm trying not to talk about, but I keep referring to, is COVID. Again, we're all talking about a COVID vaccine. I was listening to WHO Chief Scientist speak yesterday, and she mentioned the fact that it usually takes about 8 to 10 years to develop a vaccine. The fastest we've ever developed a vaccine is 5 years, and that was for the Ebola vaccine. And now with COVID, we're hoping to develop something. When I say we, I mean scientists in the scientific community is hoping to develop a vaccine for COVID within the next 18 or so months. So if we are able to do such a thing, it will be truly innovative, it will be truly game-changing. And of course, us on the continent, the next question becomes equality of access, of course. We'll discuss that separately. But I'm going back to this issue of innovation. On that note, you brought us nicely onto it. If you're still with us, talk to us a little bit about your perspectives on innovation in the context of healthcare in Africa. Ife, you have the floor.
I thank you very much. So I think this period in time really is an opportunity to rethink everything that we know about healthcare delivery and like solving the problems, right? One of the encouraging things, I guess, or silver linings about the situation is that people have been to kind of adopt technology quicker. So for example, now during the lockdowns, right, because there's COVID and because there's a lockdown, that doesn't mean people won't get sick, or it doesn't mean, people who have chronic diseases or people who are giving birth don't need access to healthcare. So what we did at Helium Health is to accelerate the launch of our telemedicine platform. And because we provide technology to providers, and these people who we've been kind of trying to encourage to use telemedicine for a bit, they're like, no, right? But that's not being able to see their patients in person. We're like, okay, we need to deliver care to our patients. We're losing money because, people aren't coming into the hospital. So this opportunity has made this circumstance has made people open to different possibilities. Okay, now we can deliver primary care via telemedicine. What else can we do with telemedicine? Can we reimagine, our traditional primary care centers as maybe telemedicine, instead of one primary care center that's the only one in a 30-mile radius? Can we have one telemedicine kiosk staffed by, other health workers, like a nurse and a lab technician? Can we have 5 of those instead of one primary healthcare center, right? How can we use technology to drive access and ensure that healthcare gets to everybody? So those are the things that we've been thinking about at Helium Health, and also thinking about, okay, post-COVID, COVID is just the tip of the iceberg, honestly, because studies have come out about, COVID survivors having long-term health issues and chronic, reduced lung function and liver function and kidney function. Okay, how are we making sure that we are prepared for all of that? If we don't even know the people who have gotten COVID, if we can't even track them, how are we going to prepare for the onslaught of all these comorbidities that come up in a couple of years? And this is where technology comes in. I slightly disagree with your stance about, we were not less prepared than everybody else. I want to say that we were, right? Because especially when it comes to a technology standpoint, because, we're not able to contact trace effectively because we're not using technology. When COVID, people were preparing, when COVID landed on our shores, I guess, people were like, okay, let's get isolation centers ready. Let's prepare to deliver care to COVID patients, right? But people were not thinking about, okay, what technology are we going to use to make this more efficient? What technology are we going to use to make sure that we're keeping track? We even know that the impact, our response is impactful. How are we keeping track of all of this? Nobody was really thinking about that. So I'd say that it's really, this period is an opportunity for us to rethink healthcare and healthcare delivery and really double down on the adoption of technology and, data and using this opportunity to advocate for evidence-based policies and decision making is what I'd say.
Thank you so much. Charles, I know you have a particular interest in digital health, so I'm going to give you the floor next. And I want you to reflect a little bit on the issue of innovation, digital health, etc., and also maybe you can tell us a little bit about what you think in terms of establishing a balance between the basics and what we're calling these modern solutions. You mentioned earlier that the answer to COVID was wash your hands. And something that I sometimes say to my peers is that you cannot digitize a facility that has no electricity. Some of these basic, sort of answers have not yet been addressed in many of our healthcare facilities and many of our systems. So how do we establish that balance between, yes, being in quote unquote modern, but at the same time addressing those basic needs? Charles, the floor is yours.
Thank you very much. And like I reflected a bit earlier, I have a bit of a struggle with modern, because what have we, and I'm always one of those people who like to take back steps and look at where we are, what's the premise, what are we dealing with, because then that becomes an integration of an innovation rather than pick this and let it work for you. Having said that, you mentioned clearly that, and Ifeoluwa has actually also alluded to the fact that, innovation is inevitable. Technology is inevitable. Fintechs are using it. Agriculture is using it. Every other field is using it. So health definitely has to sort of be a balance. But then also, because of the other things, that the sensitivity of healthcare and its duality, what I started by saying, life and death, also has to be very, very highly considered. The other thing that we have to say is that out-of-pocket expenditure for healthcare in Africa is very, very high. So you have to really think, how do I still deliver this healthcare and with this technology, but still make it very affordable for you, almost nil, in terms of you expending from your pocket. And for us at mHealth, what we ask ourselves is that, what does that person have? They have a mobile phone. Okay, so how can we make them healthy? And so we sit down with government and develop projects that are going to be friendly to that particular person. So, for example, we do have a bit of work that is supporting 300,000 people who are living with HIV and AIDS in Kenya. And it's very simple. So what we do, we maintain for them digital diaries. We send them reminders to stick onto adherence for medication. We health messages, and and the healthcare worker will know which patients am I expecting today from every morning they will receive an SMS. These are your patients and these are the people that you're expecting. And then, and so if they don't come on that particular day, then he will know patient Charles and patient Mwenya didn't come. And so it's easy for the healthcare worker to follow up on those. So this has really increased on adherence. I know we've been struggling to walk away from COVID, but then we are in COVID time, so it's only fair. And so mHealth Kenya has been supporting the Emergency Operations Center, the Ministry of Health, for the last 4 years. And we've digitized the reception, coordination, and dispatch of response for any public health crisis. And what happened? So we were very instrumental. We have monitored almost up to 40 infectious diseases over the last 5 years. We were very instrumental in the control of guinea worm in Kenya. And so when COVID happened, and it's a conversation we had with the head of the EOC, he said, I have a manual process of calling people every day to ask them how they're doing. That was a quarantine, the 14-day quarantine. And we say, don't worry, we'll add a module onto the already existing system for us to track COVID-19. And the fact that this makes it very easy for the healthcare worker to follow up on people. Of course, the system has really changed with the changing times. So as we're speaking right now, we have mHealth Kenya, the system that we have developed has now been sanctioned by the government of Kenya, and it's a system for use for home-based care and isolation. We are also in conversations within the region to see how we can expand that particular system. But then but I also come back to the thing about, what do you have and what can we work with? And I think in terms of using the word modern medicine, there's a lot that comes with that, because the expectation is that it will be accepted. And so the way we look at it, and the way we approach community, and the way we look at how we can strengthen health systems with using technology is looking at what do you have and what can we enforce. I've seen most African communities have a very big problem with, if something is just brought to them, if it's just dumped to them, just told, okay, go ahead and use this. And really and it's not to say that they have not had a method of doing what you are saying that they should do. They have had it. So how can you work with that particular method to innovate around it to increase acceptance? Because for any innovation, the old saying goes, I may paraphrase, not remember very well, people are very stiff to change. So it's very difficult for someone to just accept something because it is modern, it's being used. So we normally, at MLK, we normally innovate our solutions are surrounding that particular person. Looking at the healthcare workup, what problem do you have? My patients are not reporting. They're not adhering to their medications. You, patient, why are you not doing this? It's because sometimes I forget. What if we set you a reminder? Oh, we like that, and then all of a sudden you have 99% of adherence. So it's revolving around the person that we can actually achieve. Thanks, Mwenya.
Yeah, absolutely. Thank you so much. We have about 10 minutes left of our session. I'm going to encourage our participants to ask questions through the chat section here, and we'll see in the time that we're given if we can address one or two questions that may be asked. Tetteh, the floor is yours. What is your take on innovation in healthcare? In Africa, of course.
And I'll be brief in the interest of time. I think with regards to innovation, specifically thinking about my sector, it's already being done quite rapidly. As Charles, you mentioned this, things like telephones and phones, communication via sessions and checking up on individual psychological, as well as sharing information on how to do so, is taking place with regularity. I'm sure many of you, like myself, have come across various step-by-step memes on ways to check in with oneself, personal self-care, just making sure we're all right in light of everything going on globally. But again, I think the further step for us to be innovative is to continue to be creative in utilizing our own traditions within the framework. By that, I mean, and thinking of a book called Hero of the African Face by, I believe his first name is Clyde Ford. Within it, he discusses how or makes the presentation that the stories and traditions, our oral traditions, were often used not just to tell stories, but to deliver messages. So the space of thinking of how creatives are the ones that fundamentally help move innovation. How do we, and I often think about this in the mental health space, how do we operationalize our stories in the oral tradition to communicate tales and instructions of what it's like to analyze a particular difficulty and how the end result may be more beneficial? In this case, think of one of my favorite tales, which is the story of Anansi, and when he was out with his son getting coconuts. That addressed hubris, that addressed reflection, and that also addressed the time it takes and the impact one can have if reflecting on something. So just using those and marrying what was, at least in my case, a very Western-centered education with a African-centered framework can be massively beneficial to being innovative in our approaches to bringing forth further mental health care.
Fantastic. Thank you so much. Sodiq, why don't you give us some of your insight on innovation in healthcare?
Yes, thank you.
2 minutes.
Yes. Just because of the time. Yes, for me, I feel like young Africans actually come to realize that the decision is in our hands now to make, and everyone's already innovating around healthcare. And to be honest, I'm really glad to see that we are companies around Africa trying to improve the healthcare system of the the continent. And for when you're a blood donor, normally blood donors do not have, what they do is just walk into a blood donation center when there's a need, when they feel like donating blood. But with the help of some like Bank's blood donor application, you get reminders to tell you, okay, yes, you need to donate blood. You donated the last time you donated blood was about 5 months ago, 6 months ago, and give you tips on the importance of donation and all of that. And I feel those are really critical, because the innovation they do to help people get awareness, and there is a need for you to to be reminded. Yes. So I feel like innovation in our healthcare is really, is really growing, and I cannot wait to see it grow even bigger. Yeah, thank you.
Fantastic. Thank you so much. Just to go to some of our comments, we have a comment here from Milensu. I'm glad to see mental health as one of the discussion points in this panel. I think in the time of social media, young people have more tools to signal and express issues related to how they feel. And again, this speaks to the cross-cutting sort of nature of healthcare. The fact that they're bringing up social media and those kinds of technological aspects to me are also key and also important. I'm sure, Tetteh, you'd agree with that. There's another comment here. Great insights from Ife. Leveraging on technology in achieving healthcare for all is key. However, is Africa fully ready for this? ? Another quick comment there, which I thought was quite interesting, was on the issue of micro insurance schemes and whether they would help them access health and better care. I don't know if any of you want to address some of these questions in literally 1 minute. Ife, do you want to talk a little bit about, is Africa ready for technology in achieving healthcare for all?
I think ready or not, the circumstances that determine, the circumstances that necessitate us using technology are here, like COVID, for example, right? So I think it behooves us to invest in digital health and healthcare because honestly, I don't think this is going to be the only pandemic or the only global health crisis that's going to happen in the next 5 years or 10 years. There will be more. So I think we just have to be creative about how we're spending money, right? So are we going to spend money building a primary healthcare center that is, understaffed or that is out of reach of people, or are we going to reinvest that money and say, okay, this is how we're going to creatively do this? We're going to invest in telecoms. We're going to make it possible for people to access world-class care where they are by bringing the doctors to them via telemedicine, right? So I think we have no choice but to be ready and to be creative about how we solve these.
Thank you. Charles, can you touch on the issue of the informal economy and access to microinsurance schemes? What are your thoughts on that? We can't hear you.
I'm saying the fact that it's an innovation within the fintech space, trying to see how can we bank the unbanked. And I think the same discussion when you talk about getting to a healthy nature, how can we, get those who cannot afford healthcare. And so microinsurances, small, collective saving for insurance. I think that is something that is it's a growing innovation. It's happening a lot in Kenya. Paying for, and I'll give a very quick example. So, for example, Safaricom, which is our biggest telco in Kenya, and I think within the region, arguably. So, when this pandemic happened, so they normally there's a loyalty program when you call with your phone, so you get what you call bonga points. And so, for those bonga points, what they did, they said you can also use those bonga points to purchase food, and families have really been surviving on that. So, I think it's innovating around what is there and what can be done. I think informal, you can never really have a conversation about universal health coverage if everyone is not on the table. So informal informal or formal, if other tech spaces like the fintech, the agri-tech are using it, it's only time that healthcare steps up.
Thank you. Thank you so much. There's still comments coming in, but unfortunately we are out of time. So I'm going to go ahead and close this discussion. Thank you so much to our panelists for your very insightful and interesting comments. This has been Modern Medicine in Africa. My name is Dr. Mwenya Kasonde. Thank you so much. Bye-bye.
Thank you very much. Sanitize and
Take care, everyone. Absolutely.
All right, thank you, everyone. We're now proceeding on to the next session, that is bootstrapping a startup in Africa. Please click on the sessions tab on the left-hand side or at the top right-hand menu if you're on mobile for us to move to the next session on bootstrapping a startup in Africa. Thank you everyone for your time and attention, really appreciate it.